Hi everyone, especially to you Sir Alonzo. I am Serena Sambas, and for this presentation, I am going to talk about or discuss the normal chest CT scan and the common diseases that we see in the chest CT scan. For this presentation, I provided some examples of what a normal chest CT scan looks like and what is the appearance of the chest for CT scan if the image have that particular disease. Before anything else, let's identify first what modality we use to visualize the chest of the patient. So we use the chest CT or the computed tomography scan. So it is an imaging method that uses X-rays to create cross-sectional pictures of the chest or the thorax and the upper abdomen of the patients. So in this procedure, a thin X-ray beam is rotated around the area of the body to be visualized. Using a very complicated mathematical algorithms, the computer is able to generate a 3D image of a section through the body. So the CT scans are very detailed and it provides excellent information for the physician or for the radiologist for them to interpret the image well. So now let's proceed. In this picture, it illustrates a normal chest CT exam. So as you can see in the image, a normal lungs looks like completely black in a CT scan. So for this, you can able see any ground glass opacity or the GGO in the area. So when we say GGO or the ground glass opacity, it refers to the hazy gray areas that can show up in a CT scan or X-ray of lungs. And also, sa image, it doesn't have any crazy paving, which most likely makita na to sa patient ka na ay COVID-19 or pneumonia. And also, walay halo sign na makita sa lungs. So, ang crazy paving na makita nato sa CT scan is a scattered or diffuse ground glass attenuation with superimposed interlobular septal thickening and intralobular lines. So, for the halo sign naman, it is a circular area of ground glass attenuation that is seen around pulmonary nodules at computed tomography or the CT scan. So in this image, this is a sequence of 6 axial CT or computed tomography scans through the thorax of a 30-year-old man. So looking at the pictures, it shows a normal lungs and heart of the patient. So the front of the chest of the patient is located here at the top. So kani siya na area. Kani siya ang chest, and the right side sa patient is kani siya, which is na siya sa left side sa image. Pag ang lungs nato is nag-appear lang siya totally blocked or walay any ground glass opacity or mga halo sign na makita nimo, pasabot ang patient nato or ang CT scan na resulta is normal siya. So walay any condition or disease ang patient nato. So this is the CT scan of the upper chest or the thorax that shows a malignant thyroid tumor or cancer. Dark area around the trachea, which is kani siya nga side or na area, it is an area where the normal tissue has been eroded or gradually destroyed and died. So, ang result ani is na ay tumor nga mo grow sa diri ang area. That's why ang finding ani is malignant thyroid tumor or cancer. So, this CT scan naman shows a single lesion or a pulmonary nodule in the right lung. So, mo ni siya ang right lung sa patient. So, since nag-refer mo sa picture diri so nakalocate siya diri sa left side, pero mo ni siya ang right lung sa patient. So, kani makita niyo this nodule is seen as the light circle in the upper portion. Kung normal lang diba siya nga lung, so dapat ang appearance niya is ani lang siya, but since naa siya lesion diri ay nakita nga light circles sa area sa patient here sa right side. So, ang patient na ay pulmonary nodule or single lesion. This is a CT scan of the upper lungs. So, this individual has a mass in the upper part of the right lung. Muna siya ang right lung sa patient. So, makita man niyo diri asa ang ginatukoy niya nga mass, which is nado sa upper. So, this one, gina-point out sa arrow. So, when we say mass, it is an abnormal spot or area in the lungs. And the reason why they call this mass, kay ano man siya, larger than 3 centimeters and about 1.5 inches, that's why mass ang gitawag sa iya. So, this chest CT scan shows a cross-section of a person with a bronchial cancer. mapansin niyo dito sa picture guys, the two dark areas here are the lungs. So, muna siya ang lungs sa patient nato. And the light areas here, or the white spot, are muna siya nag-represent sa cancer. Since ang ginatukoy diri is bronchial cancer man siya, which is nag-refer siya sa type of cancer that starts in the mucous glands and ducts of the lung airways, which is the bronchi, or the windpipe, which is the trachea, and in the salivary glands. So, ang gina-represent aning sakit is bronchial cancer, and these are the representation of the cancer, kaning mga white spots here. So for this CT scan, it shows a cross-section of the lungs of a person with lung cancer. So muna siya ang image kung patient na ay lung cancer. So siya ang lungs na patient. The light areas in the right lung represents cancer. So what I've said sa mga previous slides, ang uban na mga spots there kaya nag-represent siya o particular nga disease. So for this one, kani siya nga ang gina-represent ani nga spot is cancer. So that's why ito siya nga lung cancer. So for this image, the observation was made by some radiologists. They're often seeing this pattern or sometimes seeing this pattern called a reverse halo sign or reverse halo appearance, but also they call this Pato sign. And for this, it involves opacities or infiltrates with more peripheral high attenuation and lower attenuation centrally. So when we say reverse halo sign, also known as the Pato sign, ang definition here is central ground opacity surrounded by denser consolidation of crescentic shape. I mean to say, ang form niya is more than 3/4 of a circle. So not totally circle siya. So 3/4 lang siya kung i-estimate nimo siya. Sa computed tomography na scan, it shows a ground glass, which is a severe COVID-19 infection. Sometimes manggod ang ginaingon nila na yung aning appearance is pneumonia, but na yung mga radiologist or physician for findings nila is COVID-19 infection. So for this one also, it is caused by a fluid in the lungs. So possible mo po na siya ang reason why naayong aning appearance or nga naayong aning sakit ang patient. So for the last slide, we have the dynamic changes of the chest CT scans of the 3 symptomatic patients. So lahi-lahi na siya na case, guys. So from A to C, this is the case 1, which is for our first patient. So for D to F, muna siya itong case 2, which is itong ikaduwa nga patient. And from G to I, muna siya ito ang case 3, which is for our third patient. So let's look at the image one by one. So for A, muna siya itong case 1, which is for our first patient. So makita niyo guys sa image na normal lang dyan siya, like wala kayo makita na any ground glass opacity or mga crazy paving or mga reverse halo sign sa image. Unlike sa P nga image, makita ninyo kaning mga arrow there guys, muna siya ang representation sa ground glass opacity. So kani siya guys, nag-represent na siya og eye disease from this patient. So kani nakuha niya siya after 2 days, nagpa-CT scan na po siya. So kani ang naging resulta sa iyang CT scan. For the next pagpa-CT scan na po niya, which is 1 week later, it showed this. So mas further na ang progression ng kanyang pneumonia here. So ang finding ani nga disease is pneumonia sa atong patient 1. So for the case 2, which is this, for starting sa D until F, for our second patient, again, ang sa D, normal gyapon ito makita, wala tayong makita ng mga any signs or pattern na nagapakita nga ang patient ay disease. But, the moment na nagpa-follow up siya, CT scan na po siya, 3 days later, na nakita sa ihang chest, which is kani, yung mga arrow, kaning mga arrow diri nagpakita siya og multiple ground glass opacity. So kani siya. For this one, after having this CT scan, nag-take na po siya another shot of CT scan sa iyang chest 4 days later. Kani siya sa F. Kita ninyo guys na medyo mas dako siya compare sa last time na niya pagpa-CT scan. Ang finding ani guys is na ay lesion ang patient. So kung lesion, it is a nodule that is seen as the light circle of a CT scan. So medyo circle ang iyang ang iyang forma diri sa CT scan. So ang patient nato diri is partial lesion. For the last patient nato, which is the phase 3 from G to I, ano siya observation sa CT scan niya. Sa first pagpa-CT scan niya, ang finding or ang resulta is normal lang siya. Wala any pattern or sign na makita nimo nga naa siya sakit. But the moment nga nagpa-follow up just CT scan na pod siya, after 3 days, nakita na diri nga na ay mga ground glass na pod. So, means to say na ay possible disease ang patient. Or may balaan dyan mo kung saan na possible disease na ang sa imo. So, di pa mo siya satisfied. Nag-undergo na po siya another CT scan, which is 3 days after having this scan, which is letter H. Pagpa-CT scan niya again, pumoni siya ang appearance. So, makita naman niyo na mas dako na dyan ang ground glass opacities diri sa patient. By this, ma-confirm na dyan na ang patient na siya particular disease. So, kanina cases is different na sila pero pansin niyo na pare-pareha lang sila na ground glass opacity na makita sa lungs. Ma-differentiate nimo ang patient sa normal kung sa na particular disease. If ever ang patient normal lang siya, dapat ang appearance sa iyang lungs is totally black. So wala kay makita na any ground glass opacity. So, unlike sa patient na na disease, naadyo kay makita na any pattern or signs na possible makakos sa iya og particular disease. Much better the moment na maka-feel na og something ang patient. If ever naadyo siya ma-feel na something off sa lawas, dapat magpa-undergo na siya og CT scan or kung dili, pwede pa siya magpa chest x-ray sa first. So that would be all. Thank